Our third speaker is Cindy Raymer. Cindy is a certified nurse aide life skills coordinator in Waterloo. Cindy is one of the over 50,000 direct care workers in Iowa. These are the people who work on the front lines in nursing homes, assisted living centers, in the homes of individual Iowans, and in community-based services. These workers provide direct care and support to aging Iowans and to Iowans with disabilities. These workers also have among the highest uninsured rates of any other occupation, approximately 24%. Cindy is one of them. Welcome, Cindy.
Hi. I want to say, first of all, that thinking about it on the way down here today, I realized this is the first place I told my story about 6 years ago, so it's appropriate that I'm here today. Back in the late 1990s, my husband was diagnosed with diabetes, and he worked in a small construction company and didn't have any coverage. At that time, I didn't have any either because what they offered me was unaffordable for us. He struggled with controlling his diabetes. In about 2001, he was not feeling well, and the hospital diagnosed that he had had a heart attack and needed to have a stent placed in the widowmaker artery. The debt from the procedure and the stay in intensive care was over $33,000. We struggled to pay the debt and finally decided that with his medications and doctor's visits, there was just no way we could afford to pay it off, so we ended up filing bankruptcy. A while after that, I checked to see if possibly we could afford to go on the plan that I had at work, and I was quoted $400 a month for both of us, except that Jim's pre-existing would not be covered for the first year. And I looked at him and said, how do I pay this and still buy his meds and take him to the doctor? So we continued on without. On November 6, 2005, Jim suffered a massive heart attack and passed away. I was left to deal with his loss and the medical and burial debts of around $20,000. A couple of years ago, I called my doctor's office to make an appointment for a checkup and was told that I needed to pay off a smaller bill of my own before I could be seen. It made me feel like I was a second-class citizen because I didn't have the money and couldn't receive the care. Today I'm still without basic medical insurance. I go to free health screenings and health fairs to pick up some of that, and I just don't think it's fair that I'm caring for people to take care of their health and I have no health care of my own. I'm not asking for a handout. I'm just asking for something I can afford and that won't have all these restrictions. It won't cover this. And the passage of the federal health care reform law changes all that. I will finally be able to get health care coverage that will serve my needs by using the health care exchange. And I will finally be able to get health care coverage that I can afford and being eligible for probably some premium subsidies. That means a lot to me and millions of other Americans like me.
Thank you, Cindy.